Hi guys, Dr. Brotsky here. You're 36 weeks pregnant. Can you believe it? You could possibly be pregnant another month. That's what everybody says. So most people by this time are sick of being pregnant, but hang in there. All the pressure, all the cramping, all the early contractions, it's all for the good of a healthy full-term baby. So just last a little bit longer, you're almost there. You're down to weekly visits. What you can expect is, like I mentioned, more pressure in your pelvis, more frequent urination, those Braxton Hicks contractions, which are just tightening in your belly without a lot of pain, and they're probably irregular. They're probably worse when you are more active or when you're stressed out. So if they go away when you sit down and rest and relax, it's nothing to stress out about, but definitely make your doctor aware of it. You also may notice that your baby drops down lower in your pelvis at this time. So if you were having rib pain, you may notice that that kind of goes away. Acid reflux can actually go away a little bit too at this point, just because the baby drops down lower in your pelvis and you have more room up top. So that can be good and bad. As far as the doctor visit goes, like I mentioned, you're down to weekly visits. If you didn't get a Group B strep test last week, then we do it this week. The exception to that is if we find Group B strep in an early urine culture during pregnancy. Then you can opt out of it and we just treat you just to be safe. Your doctor's definitely going to go over the specific signs and symptoms of labor with you at this point, so just make sure you're communicating with them and that you have all your questions answered. And they also may start checking your cervix at this point. So it's not comfortable, it can be painful. I always tell patients there's no medical reason I have to do it unless they want me to because of curiosity, or if we need to talk about inducing you for a medical reason. So just keep that in mind. It's not something that has to be done, but a lot of people are just very curious to see if their cervix is starting to change. Things you can be doing right now are making sure your bag is ready, like I mentioned before. And a lot of things that people put in their hospital bag are just comfortable clothes that you would wear to go to bed, basically. So people will pack robes, pack slippers with some tread on the bottom so that you don't slip and fall when you're walking around the hospital hall. You can also pack special items like things that you want your baby to go home in, little cute onesies or outfits that you've picked out. They have diapers and they have wipes in the hospital. They also have a breast pump that you can use, although sometimes it is beneficial to bring your own, just because it can really help you get used to using your pump, and you can answer all your questions with a lactation consultant at that point. Also remember to get your car seat. You've probably already gotten it by this point and had a baby shower, but if you haven't, make sure that it's out of the box at least, and that it's available so that if something happens, you can go ahead and install that and the baby can go home easily. That's it for week 36. We'll see you next time. Thank you so much for tuning in. Check out all my other videos, and you can find me at drbrotsky.com.